Hello, my name is Michael Mouzakis. I work as a consultant cosmetic doctor here at the private clinic in Birmingham and Leeds. I'm trained in the UK as a plastic surgeon in Cambridgeshire, East Anglia and London, and I have a special interest in hair restoration.
Okay, my name is Douglas, I'm 35 years old and I'm a boxing MC from Glasgow.
Over the past 5 years I'm performing a modified follicular unit extraction to offer hair restoration, and I have performed more than 800 procedures. And my aim is to deliver a scar-free result, natural result, with the minimum discomfort.
Probably in my late 20s, I became increasingly aware that my hairline was beginning to recede. As a boxing MC, a lot of the events I work on, there's a lot of photography and social media, and some of them are televised.
So this procedure is quite popular and became popular in the last 5 to 6 years, especially in men. It's in top 5 of minimally invasive procedures for male patients, and in the last 2 years became really popular among the population of women.
I've literally spent a year reading all the forums, going online, weighing up differences between doing the procedure here in the UK or doing it abroad. I've had 3 different consultations as well, and I have to say that of the 3 different surgeons and the 3 different companies I dealt with, the one I was most comfortable with by a country mile was the private clinic.
The patient is the ideal candidate because he's in good health, first of all. He's at the perfect age to have a stable pattern of hair loss, because we can never predict the pattern of his hair loss, but the older you are, the better chances you have to have a stable pattern. And also he has reasonable expectations. That's why this technique can give him a nice natural result without with a minimum downtime. Okay, we're done with the local anesthetic. We're doing the harvesting of the grafts. We're using a 0.7 punch, and one by one, like this, we extract the hair follicles, actually the grafts that contain the hair follicles. So by doing that, you can see that he has a very rich donor area, and one by one, quickly we can remove the amount of grafts that we want. And as you can see over here, we have our grafts that contain the hair follicles.
I was so nervous about getting the local anaesthetic, and in actual fact it was nothing like as bad as I'd expected. And the rest of the procedure was maybe taking around about 3 hours, and for the most part actually I think I was sleeping.
We're separating the grafts in single, double, triple and quadruple, and especially in order to do the hairline, I always like to be sure that I have a very good quality of single grafts, because the single grafts will give us a very natural hairline. So Nabil over here is separating under the microscope, and as you can see we have a very good quality of grafts. Here we are with Douglas now after the extraction, in order together to decide where the hairline would be. Usually the monthly hairline starts 7 centimeters, between 7.5 and 8 centimeters from the midline of the eyebrows. And as you can see, we have the anatomical landmarks, and it's exactly 7 centimeters. So we're not going to change his hairline, okay? I'm going to mark that out, and then we'll do the same from the lateral canthus here, which is the corner of his eye, and should be a centimeter more, just to look natural. And as you can see, it's exactly 8 centimeters. My aim is to give him a natural hairline, not too low, not too high, because sometimes men tend to lose from the temples over here. So I don't want him after 5 years to end up with a small gap behind there. So that's why we keep the hairline slightly higher up, and we can give him a long-lasting result. We just finished with the local anesthetic, and we are ready to proceed with the implantation. So we're halfway there, okay, and I'd like to show to Douglas how things are now that we have restored half of his empty front. So Now you have the mirror, please have a look.
Oh, wow.
So as you can see, this is your new hairline. You can see the empty area.
Yeah.
You can compare. I think he's pleased so far. Do you want me to carry on or change everything?
No, keep going, please.
All right. So we're done with the procedure today. Douglas has not seen the final result yet. The only thing that I would like to highlight is, as you can see, though we have worked on the forehead, there is only a mild swelling. This is something that rarely happens. Okay, and I'm really glad because he's not going to have puffy eyes. So, are you ready to see the final result?
Yeah, I'm excited.
Okay, looking forward to?
Yeah.
Okay, please hold the mirror and enjoy it.
Oh, that is fantastic. How do I feel about my appearance just now? I'm absolutely buzzing about it. I can't believe that this morning I came into the private clinic with a hairline that I hated, and this afternoon I'm walking out of here with a hairline that is going to last, it's going to stay with me, and it's exactly what I've wanted. So I'm just so pleased. I can't even put into words what a difference this is going to make to me.
He's really happy, he's really pleased, and I'm really pleased with the outcome because he is smiling. The result looks really natural. And the only thing that he has to do from now on is to follow the post-op instructions that are really important, and in 9 months' time he will have an excellent result.
The post-op care instructions were superb, honestly. One of Dr Mouzakis' team went through everything with me, answered any questions that I could think of, just went through absolutely everything, and I've been given it all in a printed format as well. So
I want to see him back in roughly 6 weeks, just to keep up the continuity with my patient, to see how the donor area is healed. If there's any problem, I will be ready to take his call, and then in 6 months' time we will start seeing the frame and the first growth, the rapid growth. In 9 months' time he will have a very good result with very good length, and in a year's time we will have the final result.
Dr Mouzakis was fabulous, his team in surgery were brilliant as well, and they were just so caring and so careful. I'm so happy now that I went with a private clinic, and that's the truth. So I'm delighted with the results. I can't wait to see it continue to grow and improve month after month, but I just know already I've done the right thing.